And the transcription. Excellent. Okay, here we go. My name is Deneen Diamond. We're very excited to be here. I'm excited to introduce the wonderful panel that we have here today. The Center of Excellence is really excited about showcasing all the different job opportunities in healthcare and not just nurses and doctors. So right away, I'm just going to do a very short bio. And I'm just admitting some people, and here we go. So Alyssa and Alex are both in their third year of medical school at Dalhousie Medicine, New Brunswick. Alex grew up in Fredericton, and before going to medical school, he completed a Bachelor of Science in Kinesiology at UNB Fredericton. Alyssa is from Miramichi, and she completed an undergraduate degree in medical sciences at Dalhousie University in Halifax before starting medical school. They are also joined today by colleagues who participate in the fields of speech-language pathology, cardiology tech, medical lab tech, social work, and respiratory therapy. I'm really excited to introduce Alyssa and Alex. And just as a, I guess, personal note, Alex was in my homeroom at Leo Hayes High School, and he reached out to me this year, and I was so excited to hear from him because he became one of my favorite students in homeroom. So without further ado, handing it over to Alex and Alyssa.
Thanks, Ms. Diamond. I really appreciate the warm remarks. I'm really excited to have everyone here today. We have a really good panel, people from different healthcare professions, including Alyssa and I kind of fulfilling the role of physician. We also have cardiology, technology, speech-language pathology, medical lab technology, respiratory therapy, and social work. So we're going to go through kind of the training that it takes to get to this point, a little bit of the skills that each professional uses in their day-to-day, the type of patients that they see and type of problems that they're solving on a day-to-day basis. And then afterwards, we have some cases just kind of illustrate exactly what people would be doing in their respective professions.
Before you begin, I'm just going to ask everyone to mute except for Alyssa and Alex. I hear some background, so if you can just make sure you're on mute, that would be wonderful.
Yeah.
Excellent. Okay. Thank you.
So first, just to talk a little bit about physicians and their role in patient care. First of all, the training. You'll notice that it is kind of one of the more intensive professions here, training-wise. As Ms. Diamond mentioned, we both have 4-year undergrad degrees, and now we're 3 out of 4 years in our medical training. A bit of the day-to-day life in being a physician it really depends on the profession that you go into. I would say it's probably the profession that has the widest array of possibilities once you're in. You can kind of see on the right side of the screen there just 5 common physician specialties, whether that be pediatricians that are focused on medical problems in children, the family physician, which kind of takes care of the family unit, and sometimes that can even involve kids as well. Surgeons who are more hands-on with their skills and solve problems, like say an appendicitis, and taken into the operating room and fixing them. Internal medicines, they're kind of the problem solvers of the hospital. If anyone comes in with any weird or diseases that people don't really know about, they're kind of usually the ones involved in the care. And then obstetricians and gynecologists, they're kind of taking care of women's health, and then specifically during pregnancy, monitoring things there. So really in all these professions, you're kind of the first point of contact with patients. You're involved in kind of deciding who else should be involved in the patient care. As you'll see later in some of our cases, someone may come into the family practice and have a problem that, say, we need to send to obstetrics and gynecology or a pediatrician, as we'll highlight in one of our cases later. Some of the opportunities in the field, as I said, it's kind of a choose your own adventure. After medical school, everyone has to complete a residency, which can range from 2 to 5 years, sometimes even longer if you're choosing one of the more intensive specialties. And favorite part of our job, I would say it's building relationships. You really get to work with patients face to face, which I'm sure is going to be a theme in all the professions we talk about today, and getting to hear unique stories. Kind of part of the intake process when you go to the hospital is a history and a physical, and during that history you really get to hear lots of interesting things that people have gone through in their lives, and I find it really helpful for broadening your experience and kind of just reflecting a bit. So that's physician, and then next up, I'm going to introduce Owen, who's going to talk a little bit about cardiac technology.
Hi, everyone. My name's Owen. I'm an RCT, so a registered cardiology technologist in Miramichi. For those of you who may not know, cardiology techs are frontline workers that patients see when receiving cardiovascular care. We work alongside cardiologists and internal medicine specialists in the hospital. In doing so, we perform a variety of non-invasive testing, such as ECGs, Holter monitoring, exercise stress testing, blood pressure monitoring. We also deal with the pacemakers and implantable devices. So I heard about this course 2 years after graduating high school through a friend. I always knew I wanted to work in healthcare, but I wasn't quite sure where I wanted to fit in with that. I realized I could fulfill my education from the comfort of my own home through a program with Stenberg College. So Stenberg's a college based out of BC, so British Columbia. It's all online, so that was great when the pandemic hit back in 2020. It's 62 weeks, nonstop, no break, with 5.5 weeks of labs in Halifax and 12 weeks of clinical preceptorship, which I did at my hometown hospital. There's also other places you can take it, like CCNB, which is if you're French immersion, it's 2 years, and other courses in Ontario. So a day in my life, we work in our department doing outpatient appointments. There's a tech assigned to the floors of the hospital as well, and another tech that does the emergency department. From the time a patient presents to the ER with cardiac symptoms, it's really important for us to get there and do an ECG within 10 minutes of their arrival. We also do a fair amount of Holter scanning in a day, which is a 24-hour heart monitor. And we have pacemaker clinics multiple times a month. There's quite a few opportunities within the field, so you can continue your education and get your Bachelor of Health Sciences. So I think our credits go towards a year of that, and then you have 3 more years. You could go and broaden your scope with echocardiography, which is the ultrasound of the heart. You can go into pacemaker and implantable devices and be a device tech. I believe that's offered at BCIT. Work in private labs and also with diagnostic imaging companies, so you can help sell pacemaker equipment and other implantable devices. My favorite part of my job is seeing and doing new things every single day. So every single day I go into work and it's different. I get to see new patients every day, hear new stories. And I love working alongside other healthcare professionals as a team. And after going through my course, I just developed a good passion for cardiology. So that's it for me.
Thanks for sharing. Next up, we're going to talk about speech language pathology with Jade.
Hey guys, can you hear me okay?
Yeah.
Can you guys hear me? Yeah, okay, great. So speech language pathology is an awesome career. I can't say enough great things about it. The school and training you can do almost across Canada and lots of different universities. So you need your 4-year undergraduate first because SLP is a master's degree. There's 12 universities across Canada. There's numerous in the States as well. So if that was something that interested you to go down in the States, you can come back to Canada. You just have to write a national licensure exam to make sure that the schools corroborate enough and that you cover the right material. The master's program itself usually lasts around 2 to 3 years, depending on where you go. I myself went to Dalhousie, which is a 3-year program, which worked for me because I didn't have any prerequisites. So that's kind of one thing you always need to think about if you're doing an undergraduate and you're looking at what you want to do afterwards. Some different programs require, maybe like English courses or maybe a specific science course. So just take a look at that when you're looking through different programs. A day in the life is very eclectic because there's so many different facets of speech language pathology you can go into. So you can work with speech sound disorders with young kids. You can work with language disorders with young kids as well in the school system. If you're interested in working in the hospital, you can work with adults who have had strokes, some children who have had strokes too, people who have had traumatic brain injuries. So if they've been in car accidents or motorbike accidents or other head injuries, they can have issues with their language and production and understanding, and you get to work with them. You can also work with a lot of voice clients, which is interesting. I have some colleagues that do like voice training for singers, people who help people with voice disorders, and others who help people who have had their larynxes removed because they've had cancer. So then they work with those laryngectomy patients, and you can give them voice prostheses and help them learn how to speak in a whole new way. So depending on where you wanted to go, if you wanted an acute center or if you wanted to work in the school system, there's lots of ways you can bop around. And you get to work with so many different professionals. You work with a lot of doctors, you work with x-ray techs, you get to work with dietitians, nurses, social work. So you really get to see a lot of what's out there and get really good relationships with your colleagues as well. One of my favorite places for SLPs is working with swallowing disorders and dysphagia. That's one of my favorite parts of the job that I worked. So it's people who've had swallowing disorders, which happens a lot with strokes. So you take them into the video fluoroscopic swallowing suite and they eat and drink food that has barium in it, and you watch it on x-ray with the x-ray techs, and you evaluate their swallow to see if it's safe for them to eat or if there's different maneuvers that you can try, or perhaps they need, feeding tubes and G tubes and things like that. So it's I didn't realize how diverse this career could be. So if you're somebody who gets bored easily, I find it's a good one because you can kind of bop around and you can specialize in different areas too, which are great for opportunities. You can become that voice specialist or that swallow specialist, which is where I end up. But connecting with patients, like I think somebody said, is a big part of healthcare in general. And with SLPs, you get a lot of face-to-face, one-on-one time with patients that's just unbelievably rewarding. But that's my SLP summary.
Thanks, Jade. Next up, we're going to talk about medical lab technologists, and we actually have two people here, so I'll hand the floor to Lauren and Cassidy.
Thanks, Alex. So I'm Lauren, and this is Cassidy, and we are both lab techs, and we work in the biochemistry division. So as far as school and training goes for us, we have a couple of routes that you can take. We have two schools in the province that offer the MLT course. We have NBCC in St. John, and they have Olton College in Moncton. There is also a bachelor's degree program at UMB that you can take, the Bachelor of Med Lab Sciences. And if you start in the Bachelor of Med Lab Sciences, you are partnered in with NBCC. So you'll have to do your 2.5 years, 3 years at UMB, and then you are guaranteed a spot in St. John for the following semester for school. And it's about 2.5 years at NBCC for the course. You do 2 years in school, and then you do a 6-month preceptor clinical aspect of it where you get to see all of the areas within the laboratory medicine department because we are a fairly diverse area. During that clinical portion, you do get a lot of hands-on training, which is so key because everything that we learn in school has a lot of the theory base, because we as technologists and not technicians are supposed to have a deeper understanding of the theory behind everything that we're doing. So school is, you get all the background information and the historical information, and then when you get to your workplace, you get to see how things are done with current technology, which is fantastic. Some of our responsibilities, we do a lot of sample preparation. So we're dealing with every kind of sample you could get from a body: blood, urine, stool, spinal fluid, body fluids, knee fluids, whatever kind of fluid. If it comes from a body, we can do a test on it. So we have to do all the sample testing, and then we're also responsible for the reporting, which if you have critical values, these are what are considered make or break values of this needs to be sent along to a physician immediately because something needs to be happened. Somebody needs to act on this information immediately because patient could die from this. So we are a very key aspect of this healthcare team, and we're very in behind the shadows. Opportunity. Job opportunities. So there's lots of things that we can do as a lab tech. You could end up working in a clinical hospital where both Cassidy and I work at. You could work in a veterinary lab. You could work in a water testing lab, food testing, reagent preparations. You could even work with the government. So if it has anything to do with a lab, you could probably work there. And I'll pass this over to Cassidy.
Thank you. So most medical laboratory technologists actually end up working clinically, so in the hospital. And as Lauren mentioned, there's kind of different departments within the hospital. So like Lauren and I, we work in biochemistry. So that's where you're going to get all your blood gas results, your chemistry, your preg tests. We do all the urinalysis testing. Could also work in microbiology. So that's where your urine culture and sensitivity is going to go. Your blood cultures, and recently all your COVID swabs are going there. Transfusion medicine, that's where if you need blood or blood products, so red cells, platelets, some plasma protein products, so like albumin, your coagulation factors, they're all going to come from transfusion medicine. They're going to test your blood to see your blood type, and then they're going to figure out what products we can give your other members of your healthcare team to give to you to make you better. Hematology, that's where your CBC. So when you think of like blood cells, you're going to think of red blood cells, white blood cells, platelets. That's where hematology is going to come in, and they're going to tell you like your blood cell count, morphology. They're going to tell you your coagulation studies, so that's really important. And then pathology, that's where the tissue samples are going to go. So if you go into surgery and they remove something from your body, those tissue samples are going to be sent to pathology to get prepared for microscopic analysis by a pathologist. Within clinical labs, you can also be eligible for more supervisor or managerial positions too. Laboratory technology is really different because you can either work in a large hospital or a small hospital. In the larger centers, you're usually specialized in one of the 5 departments that I just described to you. But in a smaller center, your day-to-day life is very different. So I could go from doing a urinalysis, and then the next 5 minutes, I'm going to the emergency department to draw some blood from a patient. And then I'm going back and I'm packaging samples to get sent to another hospital for testing. I could be drawing an outpatient's blood. I could be registering an outpatient for blood. I could be running their CBC and doing their chemistries at the same time. So you get a lot of different things if you work at a smaller hospital, which is kind of what I prefer. But everyone likes different things. So laboratory technology is really special, and you can kind of choose where you want to work, what you want to specialize in, and there's always room for movement in your career. So the favorite part of my job is just being part of the healthcare team. I really enjoy kind of being in the background, and no one really knows we're here, but we just always feel like we are very important, and we do get some recognition. And I really just like talking to other members of the healthcare team. So in 10 minutes, we could get a blood gas from the pulmonary function clinic. We could be calling extramural to see when the patient's last dose of medication was. And then we could also be calling a nursing staff with critical results for a patient. So we get to talk to other people. And we're really grateful to be invited here today because a lot of people don't know we're here. So thank you for that.
Yeah, neither one of us ever heard anything about laboratory medicine when we were in high school. We learned about it afterwards when we were both in university. So we were already a couple of years into school trying to figure out exactly what route we needed to take. And we went to an information session, an internal information session. And that's where we both learned about this program. And I wish this was more talked about more, because if you love the science area and doing a lot of the really nerdy lab stuff, this is great because you're doing hands-on work every single day. And that's what I love about my job, is the hands-on aspect, because I'm a little different from Cassie. I like working in the larger hospital because I do have some specialty training. So that gets me a little extra stuff to do, which I enjoy.
Thanks, guys.
Perfect. Thanks for talking a bit about your profession. And I really agree with what you said with that. When I went through high school, I didn't know about any of the professions that we are talking about today. So it's great to have you guys here. Next up, we're actually going to talk with Shane, who's a respiratory therapist.
Hi, everyone. I'm Shane. I'm currently a second-year respiratory therapy student through the UNB NBCC program. So in terms of respiratory therapists, you're going to be working with any patient who typically has issues breathing or any problems with the respiratory system. So in terms of training in school, you can obtain this through a Bachelor of Health Science. So kind of like the Med Lab Tech. It's a 5-year program. So we start out at UNB. You can do UNB St. John or Dalhousie in New Brunswick. And first year at UNB, then you'd go 3 years through NBCC, then finish off at UNB again. Or you can just obtain the diploma right through NBCC. So the day of the life of a respiratory therapist, in terms, I've just kind of based it up like a hospital setting here. So one of the main things is airway management. So code blues, or anytime there's a cardiac arrest in the hospital, there's always an RT present who's going to be at the head of the bed and basically breathing for the patient. Any intubations, so again, in the OR, ICU, in the ER, anywhere where a patient needs to have their have a tube or be intubated, and various airway devices. So sometimes endotracheal tube isn't always the best option, and there's like a plethora of different ones. Also, respiratory therapists give out respiratory treatments, so oxygen therapy, giving patients oxygen. There's many ways you can do that. Aerosol medications, so that's basically giving patients medication through a mist, and giving patients their meter dose inhalers. Respiratory therapists become experts at mechanical ventilation management. So basically, when a patient is very sick and they need the machine to breathe for them, you become the expert at running that. And there's various different modes on this machine, and then things like BiPAP and CPAP, which are forms of non-invasive ventilation. Respiratory therapists also work within diagnostics, so pulmonary function testing. So that can be testing a patient's lungs to determine different diseases they may have and the severity of those diseases. Respiratory therapists are responsible for obtaining all the arterial blood gases. So that's essentially drawing blood from an artery to look at things like pH, CO2, and oxygen in the blood to help determine different pathologies. Bedside spirometry, so that, again, that's just like a pulmonary function test, but done right at the bedside. And there's many different things, like it says there, that's just the tip of the iceberg. Some opportunities within the field: you can work in the hospital. You can do home care, so extramural work. So if a patient has home oxygen, for example, you'd go in there every month or so and check up on them. You can work in a sleep clinic, so helping people with things such as obstructive sleep apnea, coming up with treatment plans for them. Equipment sales, so again, just working with all different like ventilators, CPAP, BiPAP machines, going around selling them to hospitals. And then in terms of additional education, you can obtain something that's called cardiovascular perfusion, which you would be working in the cardiac operating room. And essentially what you do is you're operating the bypass machine. So when a patient needs their heart stopped for heart surgery, you're basically running the heart and the lungs. And an anesthesia assistant, which again, typically you work in the hospital or in the operating room alongside the anesthesiologist. And you're just coming up with different treatment plans for the patient by administering various anesthetic gases and medications. Kind of opens up your scope of practice a little more in the operating room. And my favorite part of the job, I just started clinical, so I don't have much experience, but so far it's just working in a very dynamic field on an impactful body system. So it's pretty important to breathe. And like the science is constantly changing. So like there's coming up with different methods to help patients on all the time. And it's just very rewarding seeing the progress a patient can make when coming together and coming up with a great treatment plan with the healthcare team. Yeah, that's pretty much it.
Perfect. Thanks, Shane. And the last professional that we have here talking with us today is a social worker. So I'll introduce Chelsea, and she can tell you a little bit about her profession.
Thank you. So first, thank you for having me. So for school and training, this has actually changed even since I've started social work, and I just graduated in January. So when I did my social work degree in New Brunswick, I had to have a 4-year bachelor's degree first, and then I went and did my 2-year Bachelor of Social Work. But they've just changed it. So now in New Brunswick anyway, they're offering a 4-year Bachelor of Social Work instead. So you can go into it right out of high school rather than having your undergraduate degree first. And then you can go for your master's. Some schools require you to have your bachelor's degree, whether that's the 2-year that I took or the 4-year. But some schools don't require you to have a bachelor's in social work. You can go right to your master's. So I know at Dal in Halifax, you have the option of I can do it online, my master's of social work, where I have my bachelor's. But if you don't have your bachelor's, you go for more of intense in-class training, and you can do your master's without your bachelor's. A day in the life. My day looks a little bit different than a lot of social workers, as I went into counseling rather than what you would normally think of as what a social worker would do. So I'm in the office working directly with clients. I'm mainly with children as young as the age of 5 into young adults. That's kind of the age bracket that I chose to work with, but you can work with anybody, like, of all ages. And my focus is mainly on building rapport and letting them know that they can trust me to help them, but is also advocating for them. So that could be working with schools for students. If they're really struggling in school, I can advocate for them through administrative staff, through in-school social workers, because most, if not all, schools have an in-school social worker now. Communicating with physicians, family doctors, anything like that, whether it's regarding medications or just any extra support that they would need. Opportunities in the field are highly dependent on where you're working. So I work in a private practice, so my opportunities are a little bit different. For example, like, I did my placement with Horizon, and there was more opportunities for, I don't want to say going up the ladder, but more opportunities for like manager roles or supervisor roles. Whereas in private practice, it's more or less the owner that decides who does what, rather than kind of working up the ladder, which is okay in my book. But so yeah, it's definitely different. And you can also, if you have your master's, open your own office. So that'd be different as well. My favorite part of the job is I like to help people reach their goals, whether that's a student just that has high anxiety to going into an exam and them getting through their exam, or helping them get medications or anything like that. Even the smallest steps can bring like the most joy to a person, and I love to do that. And I also love to work in teams to help the client. So, for example, I did my placement in a high school, and I was working with guidance counselors, the principals, occupational therapists, everything like that, as a big team to help students move forward. And I just love doing that. Yeah, that's all I got.
Awesome. Thank you, Chelsea. So now we have a couple cases to run through, and we're running a little bit short on time. So I think, I'm just going to do the reading of this. We would like to have kind of people talk a little bit about what they would do, but we'll just have some cases to illustrate different areas where people can be involved. And, you can kind of, you'll be able to see that some of the things people already talked about be things we want in these specific patients.
Sounds perfect, Alex.
So our first case, so we have Harold. Harold, he's a 57-year-old man. He's sitting down, having breakfast with his wife, when he noticed that he's starting to have difficulty speaking, kind of like me right now. So he reaches to touch his face because he's like, what is going on there? And he feels that it's numb, and he's actually having a bit of difficulty getting his arm up there. And so you can kind of put yourself in these shoes. You kind of happen to hear that Harold's, he's speaking normally, and then all of a sudden he's starting to slur his words. And then you look at him and you're like, oh, like his face is kind of drooping. And so you think back to this presentation that we gave you, and you realize, hey, I think this is a stroke. I'm sure you guys have probably seen this before. This is what we call a FAST in kind of stroke care identification of stroke. So the F stands for facial droop, which is common in most strokes, arm weakness, speech difficulty, and then the T, time to call 911. As we'll kind of get into in the case, stroke is a very time-sensitive diagnosis, and we want to make sure that we get them to the hospital so that we can identify if they would benefit from care as quickly as possible. So at the hospital, so EMS is promptly called. They transferred the patient to the nearest hospital. In the ER, as I said, we know that time is of the essence. So we take a quick set of vitals and then send them to the CT scanner. The vitals are really important because it can kind of give you some clues into what's going on. So say this patient came in and he had a blood pressure that was through the roof, say 210 over 100, then we might be suspecting something different than if they just had a normal blood pressure. So he goes to the CT scanner, and on his return, he had his blood drawn and an ECG taken. So as we talked about, we'd have our professionals involved here. The cardiac tech would be waiting to take that ECG. We would draw the blood, and then we would send it up to our friends in the lab to have analyzed. Because one of the things that we'd probably want to rule out here is, is this patient having a heart attack as well, which is also a very time-sensitive thing. So, get the CT result, and it confirms that there's an ischemic stroke, and he's set up with telestroke to evaluate whether he needs treatment. So we have a little picture here. This is actually what a CT scan would look like in someone where we're trying to look for a stroke. So you can see kind of the white lines kind of squiggling through the head, and you notice where the arrow is, that there's actually a blockage. So typically on the left side of the screen, you see it extends a little bit further, and then on the right, it stops. So that would be something that we call an ischemic stroke, sometimes due to like a blood clot, or it can be due to other things too. So he gets set up with telestroke, which is basically this program that we have that runs throughout New Brunswick, where once you diagnose a stroke, you go on this screen with a neurologist from somewhere in New Brunswick, and they'll do a comprehensive assessment to kind of see where the patient's deficits are and if they would benefit from certain types of therapy. Namely, there's kind of a medical therapy that can be given within a certain window, especially for this type of patient that has an ischemic stroke, that'll help break up that clot that's stuck in there. And if they're not a candidate for that, or if the neurologist feels that they're best suited to have it removed, then they can do something called thrombectomy, which is actually what this patient has. So this patient, he was transported to St. John Regional Hospital and received a thrombectomy. They were able to successfully go in and remove the clot. So these surgeons basically will go in through a vessel in your arm or sometimes in your groin and work their way all the way up through the vessel into your brain. And from there, they're able to grab the clot, bust it up, and pull it out. So unfortunately for our patient, there was already significant damage done. They remained in the hospital a few days because they were having ongoing issues with their speech and weakness in their arm. So during his recovery period, when there's more time to gather a history, the medical student learns that Harold has an extensive smoking history. He has actually been short of breath with a daily wet cough for years and hasn't seen anyone about it. So one of the things that kind of comes to mind, and I'm sure Alyssa's mind in this, is that this would be kind of your patient that you're thinking might have COPD, and that would kind of be where respiratory therapy would come in. They would do a pulmonary function test. Maybe they would advise on some medications that could be given to the patient in hospital or facilitate that type of therapy. Additionally, I think this patient would benefit from seeing cardiac technology and a cardiologist to have an echo done to evaluate their heart and make sure that things are functioning well there. Yeah, and so Additionally, they would see speech language pathology for their ongoing issues with speech, and potentially PT, physiotherapy or OT, occupational therapy, which we don't have here today, but are vital parts of the team, and just making sure the patient gets back their mobility, and if they have deficits that are going to be lasting, occupational therapy can work on making assistance devices to help them carry out activities in their daily life, or say in the workplace to help them function. So I'm going to hand it off to Alyssa now, who's going to talk a little bit about our second case.
Yeah, so I just came up with another case just to kind of illustrate what everyone does from a different perspective. So the second case is about Jude, who's a 2.5-year-old boy who comes to his family doctor for his regular checkup. And when he comes in, his mom's excited to tell you about all the new stuff that he's been able to do since he was last in. So he's now kicking a soccer ball, building towers with blocks, and he's walking up and down the stairs. So when you're watching him and playing with Jude, you notice he's happy. And he will respond to your questions, but he's only kind of saying yes or no, and he doesn't seem to say much else. So when you ask Mom about what language is like at home, she says that he does know up to 20 words, but he hasn't yet started to put them together into sentences. So one of the things that we do as medical students and as family doctors is to assess children throughout their development for what we call developmental milestones. So basically the milestones are little checklists of different skills that kids should be able to do based on their age. So just for an example, I pulled up the checklist for language and communication, but there's also lists for physical abilities, social skills, emotional skills. So we just want to make sure that everyone's meeting those milestones. So you can see for a typical 1-year-old, they should be able to respond to simple spoken requests, use gestures, which in our case, Jude is able to do all that. He's 2.5, so he does meet all of the 1-year-old milestones. But if you look to the 2-year-old milestones, one of the things in particular is saying sentences with 2 to 4 words, which he is not doing. So it might make you wonder, is there some sort of delay? Is something else going on here? So there's lots of places you could go, lots of people you could get involved, but just some ideas of things that you might want to do. You could get the hearing test with an audiologist. I know we don't have any audiologists on right now, but that's another member of the healthcare team who would make sure that Jude is actually able to hear what's going on, and that the reason for the language delay isn't just because he can't hear other people speaking. We'd also want to refer to pediatrics. So pediatricians, we have specialists who can do assessments to see whether or not there might be an underlying condition responsible for the delay. I don't know if you want to talk about the team assessments that they do in peds.
Yeah, so one of the things that would kind of raise my alarms in this patient is, I think autism has to be on our differential diagnosis, and was actually just in pediatrics this past week, and we did lots of team assessments to look for autism, and so that'll be including the pediatrician, the occupational therapist, the speech language pathologist, and basically we would observe kids playing with their parents. Then the speech therapist would come in and they'd have a series of kind of booklets to play through and see how the kid would be able to speak. Is this an isolated speech delay, or could this be something else? And then occupational therapists, they kind of work with those fine motor skills. So things like if our patient wasn't able to pick up Cheerios with, say, like a pincer grasp, or things like that, they would kind of be on the lookout. I think it was a really cool experience because you get to see a dynamic work environment where everyone's involved and talking back and forth to see, just to kind of narrow down what we think is going on with the patient. It's kind of like being a detective. I kind of feel like that with most of the patients I see throughout my day. So if you're a problem solver and you like to go looking, there's plenty out there for you to do. And the last thing is just referral to social work. There's opportunities if the patient has a speech delay, or if it does end up being autism, social work can really work to advocate for the patient, get them involved with making sure the family has adequate supports, whether that be financial or social, connecting them to programs in the community. They can really be a vital member of the team and kind of support them on more of a social side of things. So we just have a list here of some of the different learning opportunities, the education programs across the province, and then a little bit elsewhere in the Maritimes. Some of the professions, they talked about the schooling that they did, but there's plenty of options out there, as you can see on the screen. And this GMB Career Profiles in Allied Health is a really good resource if you find that you want to read more about the professions. It has lots of things about kind of what the day-to-day tasks would be, similar to what we talked about, skills involved, compensation, potentially courses that you might want to take as you're preparing in high school to go on to one of these careers. And it also has tons of other professions that we didn't talk about today. So I'd encourage everyone to look into that if you're looking for a career in healthcare. And I think it's important too to mention that you have resources available to talk about career planning. It's a very stressful time. But I think with using the resources, school guidance team, and this resource here, myblueprint.ca, that really help you plan out your post-secondary career and pathway there. So if anyone has any questions, you can put them in the chat, or feel free to talk aloud. We've also left our emails there if anyone would like to email us with specific questions, or if you want to connect with another one of the panelists, email us and then we can connect you guys.
Awesome. That was amazing, and so much information and from many professionals. So thank you everybody for attending. I know that there are a couple students on, so I'm just going to leave the floor open for a few minutes and see if anybody would like to ask some questions.
Can you hear me okay?
Yes.
Thanks so much for doing your presentation today. My name's Andrew Jones, and I'm a teacher at Grand Manan Community School. And I've kind of been I've kind of been on a little campaign for a bit about making the health jobs attractive to students. And we've found in the past that students don't go into things unless they kind of know a little bit about them and that they're excited about them. And I'd like to get students excited. And I'd like to set up something in my broad-based technology classroom where a small group would work on some things that would lead them in that direction. I'm sitting here with my blood pressure cup on that hooks to my iPhone, although it doesn't work because it says something about 151 over something. Anyhow, can't be working. Can't be working. But to do 10 activities, not serious things, but things like maybe blood typing game that they could play to learn a little bit about different blood types, or running on a treadmill and have a little ECG, KG machine. And I'd love for any of you who would have such an activity based on your specified profession, if you wanted to send something like that along to us that we could use in the classroom and get people involved in Dalhousie's program or medicine in general, that would be terrific. And I think we have a role to play in our school system to solve the problem of not enough healthcare professionals in our province. So again, thanks so much. And if you have some things you could contribute, that would be terrific.
Thank you, Mr. Jones, and thank you so much for attending. I know that you're a big advocate for the allied health and trying to get the students with hands-on experience. So I'm just going to open it up to the floor of the presenters, and any ideas right away with the question from Andrew, and if so, maybe just pipe in and maybe talk a little bit about what that would look like in the classroom.
Well, on the spot, I don't have too many ideas that come to mind, but I think there's plenty of opportunity to engage with medical students through kind of what we're doing here. As a part of our third year, we have this community project that we have to be involved in, and this is our portion of it. But certainly we have classmates and future people that are coming up. I think coming up with ways to engage in like activities where people are actually doing things is would be a great thing. So we can definitely pass that along to our colleagues and maybe get brainstorming.
That would be great. Thanks so much.
Yeah, and I will just add to that certainly, Alex, if you wanted to put that out to your group, and if they wanted to maybe add to their community project and do a meeting with myself and Andrew Jones, I certainly think Andrew would probably be willing to meet and discuss taking a look at what maybe some of those circuits would look like. And I think it would be fairly easy for us to put our heads together and come up with some solutions and maybe try and find some funding and figure out how we can bring that hands-on learning to the classroom. It is 2:16 and we are a little bit over time already. And I just want to let you know that this is going to be recorded. There were quite a few teachers that reached out and said that the timing didn't work for them. There's a lot of end of the year celebrations going on today. I don't know what that's all about, but certainly the high school students are getting really excited about wrapping up the school year, but your presentation was exactly what the Center of Excellence is all about. And we are so happy that you partnered with us about trying to expose students to the different professions within medical care and not just looking at nurses and doctors. And obviously they are very, very important, but everybody that's on this call is so important to our medical system. And sometimes I think the medical lab technician spoke about not maybe getting the credit that's due. And I will say from myself, we thank you for the work that you do. And I know that you are all unsung heroes in our system, and we appreciate everything that you do. And I think this presentation will certainly help educate our students around what that looks like. So I will be sending the link along to teachers. I'm going to put the Center of Excellence website in the chat. And the only reason that's there is so that you can go to the website. This live presentation will be put onto the virtual speaking series, so it's going to be there for a very long time. And you guys will be able to go back and watch it, or you'll be able to share it even with your own classmates, Alyssa and Alex, and say, this is what we did for our community project. Really happy about it. And I certainly will give you any feedback that I receive. So from the Center of Excellence for Health, I'd love to thank Alyssa and Alex for putting the presentation together, and for all the other professionals that joined us today. I know you are extremely busy, so taking time out of your day to help educate our New Brunswick students is super exciting on my end, but also very much appreciated. So thank you so much.
And thanks for all your effort in the process. It was great to reconnect, and hopefully the presentation will be good for students.
Absolutely. And I think this is just the beginning, Alex. So you're not rid of Mrs. Diamond yet. Thank you so much. I'm going to stop the recording.